The member for Mallee.
Mr Deputy Speaker, I'm delighted to speak to this motion which addresses one aspect of one of the most important subjects under review in this House. I'm pleased to say the Morrison-McCormack government is committed to improving healthcare across this great nation and is focused on rural and regional health, as the Stronger Communities Rural Health Strategy shows. Healthcare and service delivery is a priority to the people of my electorate, and scarcely a day goes by that I don't hear stories of individual journeys navigating regional and rural healthcare. The people of Mallee tell me they need responsive and sustainable healthcare, aged and palliative care. I'm focused on improving the outcomes of the unique rural and regional settings in which services are delivered. Structural change of Medicare funding is essential for reform in regional settings, including broadening activity funding to increase nurse practitioner and allied health services to manage chronic disease. The current Medicare task force is reviewing Medicare funding and the breadth of services it covers. I'm strongly advocating for the widening of funding for nurse practitioners. For those who do not understand the scope of nurse practitioners, they are registered nurses with experience and expertise to diagnose and treat people. They have completed additional university study at master's degree level and are considered some of the most clinically expert nurses in our health system. It is right that they are reimbursed for the level of study they have achieved and the skills they have developed and bring to their communities. Last week, I held a forum in Mildura for Mallee hospital providers. This helped me to understand the issues experienced at the coalface. I have to say there was unanimous support around the room for the role of nurse practitioners. However, those present raised concern regarding the nurse practitioners' current ability to gain Medicare funding and therefore the viability of their role in private practice under the current model. This is one of the reasons, Mr Deputy Speaker, I'm so pleased that the Morrison-McCormack government is currently reviewing the Medicare benefits schedule, and I'm advocating that billing items will be expanded to enable greater emphasis on the valuable role of nurse practitioners. I've spoken to the people of Murrayville about their nurse practitioner, Di Thornton, who is based at the Mallee Track Health Services. I had the pleasure of visiting Murrayville Cricket Club for Pink Stumps Day this year and heard from Heather and the gang there about the wonderful work that Di does in their community. We cannot overestimate the vital service nurse practitioners can make in our regional communities. I want to note, Mr Deputy Speaker, that this government has overseen a record level of funding to Medicare in 2018-19, up to $24 billion, an increase of 3.5% in benefits paid in the previous year. In fact, Mr Deputy Speaker, over the coming year, 2019-20, the budget shows an increase in Medicare benefit spending of 8.75% to $26.1 billion. Mr Deputy Speaker, total health spending will make up 20.8% of all government expenditure in 2019-20 at $104 billion. This represents $81.8 billion on health and $21.7 billion for aged care. This is a significant investment in Australia's future health and wellbeing. The national bulk billing rate of 86.2% is a 4 percentage point increase on the 2012-2013 figure of 82.2% when Labor was last in office. This increase, Mr Deputy Speaker, means that patients made 136.5 million bulk billed GP visits in 2018-19, which is up 3.3 million visits on the previous year. This indicates our government's continued commitment to Medicare and access to healthcare for everyone. I'm particularly pleased that on the 1st of July 2019, the government increased the patient rebate for further GP items on the MBS, and that specialist procedures, allied health services and other GP services such as mental health as well as after-hours services were increased by 3.3%. Mr Deputy Speaker, there are many reasons why Australia holds the #1 position for clinical outcomes in health globally. It takes strong leadership to deliver strong results, and the Morrison-McCormack government is committed to ensuring continued strong results in healthcare. This involves courageous review and commitment to deliver improved efficiencies and quality healthcare service delivery, including in regional and rural Australia.
Thank the member.